today about group therapy, so sort of the theory, the models, and then some specific direction or techniques that hopefully you can go home and apply. This talk is really geared toward people who are running groups, but even if you're not actively running groups, I still think it can be helpful to sort of understand the purpose of group and really what the different variables are with group. So let me just share my screen so we can get started. Okay, let me get us, whoops, to the beginning. Whoops, I don't know what it's doing. Just a second, having technical issues. Okay. Can everybody see that? Hopefully, let me know. Text if you're having any chat if you're having any issues seeing it. Okay. Okay, so we're going to talk about group therapy. Why is it not? There we go. So first I wanted to start with just some ideas to kind of eliminate any questions or sort of myths that might be out there about group therapy. I know when I first started in my role and the Addictions and Substance Abuse program here at UNMH, there was a lot of, I think, misinformation about group therapy. And it was pretty common that we would have both staff and patients say things like, group just doesn't work for me, I've tried it, it's not something I'm interested in, or staff saying group doesn't work for opiate users, which I always found quite interesting where that came from. So I just wanted to sort of spend a little bit of time dispelling some of that. So this question, is it a myth or a fact that groups are suited for everyone? So that's a myth, because the vast majority of people, particularly those that are struggling with addiction or substance use disorders, will definitely benefit from group. But not everybody is going to benefit from group or should be in a group. And we'll talk a little bit about some of the exceptions to the rule. Groups offer things individual therapy does not. That is a fact. So there are things that patients can get out of group, particularly this thing called universalism, which we're going to talk about in a little bit, and norming, which really cannot be captured in an individual session. So having the ability to provide both interventions is really important for good substance use treatment, because there are only certain things that patients can get out of group intervention. The main goal of group is for everyone to achieve closeness. So sometimes this is the thought that this is about having the group come together and bond and be close. And that's actually a myth too, because there's all different types of groups, and each group has a different objective or a different goal. And not always is the goal to achieve closeness or intimacy within that group. Connection potentially, but not always. And group is the treatment of choice for substance abusing populations. So again, kind of think about where you're at, what your experience has been with group, what this might be a myth or a fact. And this is actually a fact. So the vast majority of research really supports the notion that this should be our first line intervention. And part of it is because of the tremendous stigma that surrounds substance use disorders within family systems, within culture and society at large. And so for people to get together and acknowledge, not necessarily go around the room and say, I'm an addict for X, Y, and Z, like they do in AA, but really just to connect with other people that are struggling with the same types of issues that they're struggling with, to hear hope, to hear stories of change, that's extremely powerful. And also just to normalize that this is a human issue, that it's not something that is unique to them, or they're different, or they're broken, and group is the best way to provide that kind of corrective information. The next one, groups tell people how they should be. and this is a myth, right? So that's not usually the purpose of group. Although norming is part of the process of group, it's not about telling people how they should be. In fact, it's really ideally to provide skills or to help people discover who they are for themselves, not for the group to make that determination. Group pressure forces members to lose their sense of identity and conform. We hear this sometimes, that a patient might not be ready or they're too fragile. We don't want to put them in that situation. And that's not necessarily the case. The data doesn't support that. That actually groups can be very reinforcing for a person's sense of who they are, and that they can be supported in ways that they can't be supported with an individual therapist. And so kind of getting rid of this notion that our patients are fragile snowflakes and they can't handle this type of an intervention, or we need to wait until they have sort of the inner strength to be able to handle it. I think if a patient is willing to try it and you're willing to support it, and it's the right type of group, which we're going to talk about where groups can go wrong and which kinds of groups really should be selected for people in the more acute stage or the early stage of treatment, that it's not going to change their sense of identity or force them to conform. And that groups are artificial and not realistic settings for people to solve their problems or work through issues. This is also a myth. Groups, even though they might start out a little bit awkward, they really become a micro version of the person's social world or of their family dynamic. Even in skills groups or education groups, you will still see some of this stuff present itself and provide an opportunity for people to test out behaviors, healthy or otherwise, and get corrective feedback. And so it really does become a very real world setting that can be rich with learning experiences. So let's talk about process versus technique and get into some of the language. So when we're talking about group process, which some of you might be familiar with if you've taken a group class or if you've had training in how to run groups, what this is really addressing are the elements basic to what is going on in the group. So sort of the different dynamics or the components that unfold from the group's beginning to its end. So examples would be generating trust within the group or trust with the group leader. How is conflict going to emerge in the group and how are you going to address it? Giving feedback both to each other as group members but also as the facilitator. And then what are the norms of the group? Now that's different from group technique, which technique is the specific intervention that is aimed at facilitating the group process. So those are the things that the facilitator does to help the group move through the process that it is designed to move through. And this could be things like the initial interviews that you might do to select group members, doing things like role plays in groups, practicing conflict management, assigning homework or practice assignments. All of these things are some of the techniques that are going to help people to move through the process that is recommended. So we talked about not all groups are the same, and that's really, really important because I think there has been a long history in the substance abuse world of having the traditional group that is available in residential, inpatient, or even outpatient settings being this thing called a process group, which is let's get a bunch of people together in a room and let's just have them talk and see where we get. And that's not always the most productive type of group for people, especially early in treatment. So opening up the idea that there are actually different types of groups and that we can be very strategic both in having multiple types of groups available in our setting, but also in making strategic recommendations for patients and educating them on what type of group is going to be best fitted for their needs at this point in their recovery. So the first type of group, and what I'd say is probably the best tolerated for the vast majority of people, and in fact I would say most of us have been in one or more of these groups or may actively be in these groups at the moment. These are task groups, and this is essentially a group of people that get together to achieve a specific goal, whatever that might be. So we have a very discrete focus. It's usually a discrete timeline. We're going to meet for this amount of time, for this many weeks, and at the end this is the goal we're trying to accomplish. Now, when we're getting into therapy groups, the next level are called psychoeducation groups or skills groups. And this is really, these are the groups that we're saying the goal is not necessarily for people to disclose. In fact, we want to really help them to not disclose in these groups. We don't want them to be vulnerable. We're not trying to push people to make connections and bond. The purpose of these groups is to provide education and skills. And so it's a lot more like a class. It has a lot more structure and is much better tolerated for people early in recovery. Then the next level, where we're getting a little bit deeper into active work, when people are ready and they're sort of in that action phase in their stage of recovery, are what we're going to call counseling groups or counseling skills groups. And this is where we're trying to integrate both skills and education, but also with a here and now framework. So having them discuss what's going on with you right now. How are you going to apply this skill? How is this going to relate to your life? So anybody who's doing the matrix model, for example, a lot of the matrix groups are this type of group. It's not really a process group. It's not just a psychoed group. It's a combination of psychoed plus the ability to kind of discuss and process the reaction to the content of the day. Then the next level is psychotherapy or process groups. And these are for people that are really in the action to maintenance phase. So in the action stage of change where people want to actively be working on something. And these can be, these psychotherapy groups, they can range from being highly structured. So for instance, a CBT, a cognitive behavioral therapy group that has a specific focus and specific content that you're going to cover, but also has a bit of processing component to it. That might be on the more structured end, but then you can have a more open-ended group as well that would be focused on, like, let's say, for instance, like a grief group or something. And then process groups are the ones where we're having people get together and work out some of their unhelpful interpersonal tendencies or how they're interacting with the greater world, having them acted out in the group with each other and get corrective feedback to be able to learn how to be more interpersonally effective. And in those types of groups is when we might be addressing some past influences or past difficulties, where you're providing a safe space, a trusting environment for people to be able to self-disclose at a higher level. And really these types of groups should be closed. They should not necessarily be an open group where people are jumping in at any point. They should be a closed group format where people are sort of limited in terms of when people can join and when they end. Okay. So I like to think of it in this pyramid model. This is sort of how I understand those different types of groups. You think about at the bottom of the pyramid, which is applicable to the largest group of people and people early in recovery and people that are really acute, that are struggling to kind of self-monitor. They might really be deficient in a whole number of skills. They're going to feel very vulnerable. They're not going to be able to contain their emotions very well because those are skills. They can't tolerate a lot of distress, a lot of noise, a lot of stimulus. That a psychoeducation group or a skills group is the place to start, and where people kind of need to stay until they can develop some of those skills, because it's like a class. It's very structured. The focus is on acquiring a specific goal for that day or specific skill. There might be some opportunity to practice. There's usually some homework assigned, but it really is like a class and not like a group. So, or not the typical process group that most people experience. So when we have people who are new to treatment and come to our clinic at ASAP, we provide that corrective education. When they say, I don't want to do group, I don't like group, it hasn't worked for me. Usually what their experience has been is they've been thrown into a process group or therapy group way too soon, and they don't have the skills to be able to regulate themselves well. other people in the group have not had the skills to regulate themselves well. And so it can be quite destructive. And so they say, that didn't feel good, I didn't like that, I got in fights with people, or I felt really vulnerable and I said things and it wasn't handled well. So we're saying that's not what you're going to do. What we're going to do with these, and think of it more like a class. So we actually call our psychoed groups, we don't call them groups, we call them classes. And we have this thing called the Skills Academy, which is set up to be right from the start. This is not your typical group therapy. This really is an opportunity to learn skills and get education and practice with people who are on the same page as you. Then the next level, these are for people that are identified in that middle phase of treatment. They are stable enough to come to regular appointments. They are stable enough to be able to tolerate some process content in the moment, so being able to interact with other people, to share a little bit more. But really the goal here is on symptom remission. So a lot of the different evidence-based, mostly CBT group protocols, but sometimes ACT, acceptance and commitment therapy, or even some short-term psychodynamic group formats, they will fall in this middle zone right here, where again the goal is symptom remission, and really, are they able to engage in a closed group? Can they start at this, this week, and on this week that they're a team while they're working through their stuff? Then so this tends to be both of these highly manualized and structured. That's the best benefit, is if you can adopt some kind of a protocol. So again, Matrix would fall in this middle evidence-based psychotherapy group area here, and it is highly manualized, and that's for a reason. Then there are these things called peer groups or peer support groups. Those could be in the community. You might have them at your site. Things like AA or NA, those types of groups, they can happen at any point in a person's recovery, and they should be offered as an additional or an adjunctive service, but those are really considered outside of formal group therapy. So we see them sitting outside of the pyramid. And then the last level, and this really should only be reserved for people who are in the maintenance phase of treatment. They have really achieved a lot of skills. They have the ability to tolerate other people well, to regulate well, to manage their anger. They're at a place where they can now begin to share with other people at a deeper, more meaningful level, and that they can have exchanges that don't go so well, and tolerate it and process it and think through it. And those are the process interpersonal groups. So that should be at the tail end of treatment, to help people get to know themselves better and work through things with other people who can give them meaningful, direct feedback in the moment. So I think where we've gone wrong as a field is that we have started at the wrong end. In general, a lot of substance abuse facilities, at least in my experience in the different places I have trained, they start people at the top of the pyramid. They bring people into recovery and they throw them into these process interpersonal groups, and if it's a IOP or a residential program, they might do multiple process groups per day, where there's very little structure, where they can be getting into all kinds of drama and difficulty with other people that are in that group, and it is not an effective or helpful intervention. And so that can be quite damaging to certain people. So I think as professionals now, we know that that the science really suggests we need to understand where the person is at and match where they're at to the right intervention. And so having a menu of group options and really restricting who can go to what group will help group be a more meaningful and effective intervention for folks. So thinking about where they're at early in recovery, they really should only be in these psychoed or skills-focused classes. Then once they move into action and they're ready to really work on their condition, whether it's a mental health condition or substance use issues, we were focused on symptom reduction. Then we want to move into those closed, evidence-based groups. And then once they've completed that, their symptoms are in remission, they're in the maintenance phase, and they're really refining who they are and who they are particularly for lifelong recovery, or who they are without actively using, then we can move into some process groups or some interpersonal groups. Okay, so I hope that makes sense. The other thing to keep in mind is I think that there is a bit of a misinformation out there in the community that these process groups are the easiest ones to run because the facilitator doesn't have to prep for them. They just show up and say, let's do our introductions and you guys talk about whatever you want to talk about today. So it is been perceived as the easiest to run. Now, easiest if you don't care about it being potentially damaging. That's true. But if you do care about this being an effective group, that the process groups are actually the hardest to run. They require really understanding group theory and group process, being able to model effectively, being able to control people's interactions in the moment to join the group in a really effective way. And so this is sort of the higher level skill set in terms of group facilitation. So thinking about that, if you're running a lot of process groups and you haven't gotten additional training on it, or if you haven't taken a lot of group theory classes, I would highly, highly recommend that you look at that because there could be things that you're missing. These process groups are really quite challenging and quite difficult if they're going to be done correctly and if they're going to be done well. And we'll talk a little bit about that. So I just wanted to throw in, this is an example, this is the model that we use at ASAP, understanding people by these 3 stages. Early in recovery focuses on safety and stability. There's a whole host of skills-based classes that could be part of that group. Then in the middle, we're focused on helping people mourn and grieve all of the losses that they've experienced and tolerate and process through the really difficult stuff that they've been avoiding with their substance use. So we want to really emphasize evidence-based, symptom-focused interventions. And then at the tail end, those maintenance groups, those aftercare process groups, what we're looking at is helping people to reconnect and integrate with life in a meaningful way. And so you can have a range of groups that fall in each one of these categories. So let's talk about what does it mean to be an effective group leader, because it isn't as simple as just showing up, right? And it really, I think it's hard enough to work with, engage with, and be effective with one person, and now we're asking you to do all of those things, but with a whole room of people, and there's a whole lot of variables and a whole lot of things that can't be predicted, and so this is its own very specific skill set to be a good group leader or good group facilitator. So there are certain traits that really make somebody good at being a group leader. Being things like courageous, like being okay to walk into a room of strangers and not be so nervous you can't get through what you're trying to say. Challenging yourself to really step out of your comfort zone. Having, I think, a general sense of goodwill and caring for human beings in general, because you're going to see some bad behavior in group, and being able to roll with that, being able to not take it personally, being able to kind of understand where that's coming from and act on it in the moment is really, really important trait. Awareness of your own culture, or what we call your stimulus value. So what do you look like? Where do you come from? What's your accent? All of that stuff is going to be just like with our individual clients, it's going to be perceived a certain way. It might not be the truth, but it's going to be perceived a certain way. So you want to be aware of how you might be coming across, because that's going to be good insight as you're running the group. I think also having a sense of stamina, presence, openness is really important, because group can be pretty exhausting because you're trying to manage a whole group of people, as well as your own performance anxiety or stress or whatever's going on with you. So having a lot of stamina and being okay with being in the present moment and being open with who you are. And in fact, a lot of groups, especially later on in treatment, will encourage the facilitator to self-disclose at higher levels when it is effective for the group, because part of those process groups is joining the group, right? So being comfortable enough with yourself to share things when it's going to be effective to help the group. Now, traits are sort of things about who we are, and skills are things that we can learn. So the skills that group leaders need to really be quite practiced at are things like being able to clarify, so make reflective statements. So it sounds like you're telling me that this has been going on for you, or it sounds like you were really struggling with the practice over the past week, right? So being able to clarify, to restate things so that you're showing that you're listening really well and that you get it. Being able to do linkages, so being able to hear one person talk about their thing over here, another person talk about their thing over here, and see the common link between the two. What is the thread that links these two stories or these two comments together? And also, how can I link what they're bringing to the room to the task at hand? So if we're trying to cover particular content or some specific skill, how do I link those things we don't want to invalidate what people say because there's a reason why they brought it up. So really being able to listen for those links and make those connections explicit is really important for group leaders to be able to do. Also, to be able to interpret like the underlying meaning that someone is saying and make suggestions about what might be helpful. So it's not the same as advice giving. It's good in my practice to say, would you mind if I shared some information with you today about that? So being able to suggest certain processes or practice assignments. To be able to facilitate communication and learning is an important skill. Being able to model, being able to summarize is also a really important skill. And I think that's something that makes group really, really important, is having a very predictable beginning and a predictable end. So that usually means we start setting an agenda with the group, not necessarily going around and doing, let's do a check-in with everybody, but let's say this is what we're going to cover today. This is our goal as a group. This is our agenda. What would you guys like to add, or are we okay with this agenda? And then at the end, summarizing what was learned and saying, what is your take home from today? How are you going to take what we discussed today and put it into your life? Because that's, at the end of the day, the purpose of group is to help people do make the changes that they want to make, move forward. We don't just want to have this unique experience in group. We want them to learn something that they can take that jewel with them into their life, and being explicit at the end with being able to summarize and terminate the session. Okay. What are things that all groups need? They all need a rationale. What is the purpose of this group? Why are we doing it? And that should be very explicit. All groups need an objective or objectives. What are the things that we are trying to accomplish, both in this group as a whole, and what are the things that we're trying to accomplish today? And again, that needs to be explicit to all group members. It needs to be a practical format, so it needs to fit within reason, what your objectives are, what your rationale is, with what works in your clinic, the time that is allotted, and what your clientele can tolerate. So don't make a 2.5 hour group if that's really not tolerable for your clients. There also needs to be specified procedures, like we talked about. Really good idea to have a very specific beginning, very specific end, and that's predictable from group to group. And there also needs to be a piece of evaluation. And I think we forget about this a lot as providers because we can see the change, but we're not formalizing that. And so we think the patients see the same change that we're seeing, and that's not always the case. Or administrators might not be able to see the change, and so they don't understand the value of the group. So having some sort of, it could be a brief screen, but some sort of way of evaluating who these people are when they come in, what's my baseline score on, let's say, example, a PHQ, right? We're going to measure their depressive symptoms, or we're going to measure their quality of life. We're going to give them that at the beginning, we're going to give it again in the middle of group, and then we're going to give it at the end. And then we can look at that. Has there been change over time? If there has, I can give that feedback to the group members. I can say, look how much these scores change. I can show that to the administrators. And that is very tangible. So don't forget to have some kind of formal evaluation as part of the group process. Now I just want to spend a minute and talk about culture, because I think that this is really important. It's important both in our individual work, but it's extremely important in group. So group leaders need to be aware of some things related to culture, the impact of adverse environments and factors that might have influenced the members. So what might they have experienced in other contexts and other social groups in their life, because that stuff is going to come out in the group. You need to be aware of your own values and beliefs and how that might influence your facilitation. Is it just a real trigger for you when somebody interrupts? Do you really struggle with people who don't participate enough? So you're kind of having a negative view on that person who sits in the back and just wants to kind of get the whatever shows up. They don't want to participate. So being aware of your beliefs, and especially your hot spots, the things that are going to maybe trigger you to treat somebody in the group differently or potentially in a negative way. You also want to have a sense of respect for family and community hierarchies because, again, even if it's a skills group, that family system that the person is coming from, what their models have been working with other people is going to in some way impact how they are in that group because it is a system. It's different than how the individual is in isolation or how the individual might be one-on-one with their counselor. They're going to be different in that group. And so having an understanding of where's the family, where's the community that this person is coming from, so I can have a deeper understanding and compassion for when they do what they do in the group. Also having respect for religious and spiritual values, even though that might not be something that, that is important to you, or you might adhere to a very specific religious practice, you are going to hear an array of spirituality or lack of spirituality in the group. It will come up. And so having an awareness and an ability to work with that stuff so that you can make those links with the other people. And then also acknowledging the impact of race, culture, sex, and particularly oppression in other members in the group. So it's a good standard to sort of set that tone right at the beginning in your rules that you develop with the group. It is not going to be tolerated to have any prejudicial language or racial slurs or anything that is going to be potentially triggering to somebody in this room. So it's my job to monitor safety, and if I hear any of that stuff, I'm going to help you to pull that together, and we are going to do our absolute best, all of us, to be as respectful and kind to each other as possible. So keeping in mind that those things can be very, very damaging if they show up in a group. We can't always predict it, and having an awareness how that could come across. Okay, the other important fact of group that I think we tend to underscore is making sure that patients have informed consent and that they are aware of the limits of confidentiality. So informed consent is necessary for all groups. It's one of the core components that helps groups establish safety to be able to do the work that they're intended to do. So wanting to, again, provide the rationale. What is the nature of this group? What are the goals? What is the general structure going to look like? What can they expect and for how long? And what can they expect both from the group? So what is everybody's role here in the group? It's your guys' job to do X, and it's my job to do X, right? So you're very, very clear right from the get-go exactly what the purpose is. Why is that important? Well, we want people to make a choice to join this group and do this activity and not be caught unaware and say, that's not what I thought I signed up for, right? And then the other piece of that is being explicit with confidentiality, because confidentiality in group is different than confidentiality with individuals, but there are some similarities. And so at the beginning of every new group, we want to be providing the rationale for the group, the goals for this group, how often it's going to meet, for how long, what is the purpose and the nature of the group, so sort of those group rules, and as part of those group rules, the limits of confidentiality. So explaining that that as the leader, that you have certain roles. So if you hear people become suicidal, homicidal, if someone in their life is being abused, you're a mandated reporter. You will need to pull them aside afterwards and talk about that. What are the next steps? But also inform everybody is responsible for maintaining confidentiality. So that sort of go to what's said in this group stays in this group. And we're going to honor and respect that to the best of our ability. But keep in mind, not everybody has to do that. So if you're going to share in here, you need to have that in the back of your mind. Is this information that I am okay with or I am comfortable with putting out there in the room? I want to trust my other group members, but I also want to be very aware that that is a limit of confidentiality. So thinking about this, who is the patient, right? We're used to individual work. We know clearly who the patient is. So who is the patient in group? Well, the group, in the group, the leader's #1 job is, what do you guys think? Or what is the group leader responsible for? Any ideas? How do I fill in these blanks?
Facilitating the group and keeping order, explaining the rules, the roles, the responsibilities.
All of those things.
And gatekeeping.
Gatekeeping, right. So all those things are what they're responsible for. And what I'm hearing you say, I think that's in there, the answer to this first line, the group leader's number one job is maintaining safety, right? So it's safety for all of the individuals in the room. And that's not just suicidal, homicidal stuff, that's emotional, psychological safety. So keeping in mind, that's why it's so important to provide the rationale, so important to have rules, so important to have structure, because all of those things help people maintain safety. Awesome. And then like what you're saying, moving the group through stages, facilitating change. And what must the leader do? Maintain safety and move the group forward. We don't want people to get stuck. They get demoralized when they get stuck. So keeping in mind all those tasks that you're trying to do, you're trying to move people forward to positive change. What are risks that can occur with group? Well, it's not risk-free, absolutely. And that's why I said group isn't for everybody. And we want to be kind of thinking about who is it appropriate for. It's appropriate for the vast majority, especially those skills or psychoed groups. But there are some risks, so we want to keep that in mind. We don't want to ever pressure members to disclose or violate their privacy. There's a lot of power in social pressure, and even if we're not calling them out, they're going to feel that social pressure as other people start to share. They're going, oh my God, I'm supposed to share, I should be sharing, what's wrong with me that I'm not sharing? People are judging me, people are thinking badly of me, they think I have something to hide. So we want to just be aware that there's going to be a lot of pressure to disclose, and we can be explicit as part of maintaining safety and say that's not the goal today. The goal today is not for you guys to share. In fact, if you start to share, I run a PTSD group that's just psychoeducation, gets people ready for PTSD treatment. I say at the beginning of every group, please do not share your trauma in here. That is not the goal of today. It will be triggering for other people. You will not feel good. So if you start to go down that road, I want you to know I'm going to help you to pull that back in. I'm going to say, I appreciate you want to share this, but this is not going to be the best opportunity for you to do it in. Okay, so just know from the get-go, do not disclose. So having an awareness of which type of group you're running is going to help you to be able to moderate that pressure. Also, that confidentiality may be broken, right? There we can have people, it's a small world that we live in, and they might know each other in the community, and if they hear something in group, there's no guarantee they're not going to share it with other people or share it in an inappropriate or unhelpful way. And sometimes you have to do some mediation sessions with people when things have gone poorly in the group. Scapegoating can occur. There could be somebody that the whole group kind of joins against, or the leader doesn't like, and they pick up on that because you're the sort of role model in the group, and they sort of jump on it too. So being aware what you do has a lot of power, and if you start to notice any kind of scapegoating, you're responsible to do something about that. Confrontation can be done in a very uncaring, unhelpful manner. So getting away from any kind of confronting, calling out, public shaming, no matter what the topic is not going to be helpful and can be very toxic to the group. And then leaders just may not be competent. They might not have the skill level or the training to be able to deal with some of the things that come up in the group. So being insightful and having some reflection as to where you're at in your skill level, what you can handle and what you can't handle, and then getting further training, particularly for those higher end process groups. So guidelines that are necessary for running a good group. Again, all techniques should have a rationale. The group itself should have a rationale, but then if you're going to do something in the group, so today we're going to do a functional analysis. That's our goal for the group today. Why? Let me tell you why this is important. Let me tell you how this is going to help you, right? Always providing a rationale so they have informed consent. They get to make a choice if they're going to do it or not. Techniques should be introduced in a sensitive and timely manner, right? So we don't want to wait until the last 10 minutes of group. I've been in a lot of groups where they get lost in this. We've always done a check-in procedure. So we say your name, your substance of abuse, and I don't know, what you would do on a desert island, something like that. And it could take 15 minutes per person to go around the room and do that check-in, and before you know it, it's the end of the group and we haven't done anything. So making sure that you're doing this relatively quickly early on so there's time to address it and practice it. And don't stick with a technique that isn't working effectively. If there's something going on in a group that isn't helpful, stop it, change gears. That's okay. The group can tolerate that. And in fact, you can even be transparent about it. So last week we did X. And my experience was that it wasn't that helpful for you guys. I'd like for you to share with me what your experience was. And then you can collaborate and make a decision to do something different. Give them a choice. So think about this as they don't have to do anything. So you're inviting them to experiment with new behavior or content, but it's not required. They can sit in the back, they can participate, and they can join when they're ready. And in fact, if we model that and we get other people really excited about what we're doing, the people that are struggling a little bit more, a little more insecure, a little more uncomfortable, they will join at their comfort level. And that's going to be a lot more effective than if we pressure, require, or demand. And then use techniques that are appropriate to their cultural values and the goals of the group, right? So we don't want to be using things that are not appropriate for their educational level, what their needs are, or might be contradictory or insensitive to the culture that they're coming from. And then using techniques that are incorporated with some awareness of the here and now. People tend to be very focused on what I need to do and what I used to do, and it's hard for them to stay present. And group is an awesome, awesome opportunity to model and teach the practice of being in the here and now. Today, in this moment, this is what we're going to do. And then bringing it back. How does this feel right now? What are you thinking right now? There's tremendous power in that, and group is really excellent for being able to model. So we don't have time to watch this video, but you're going to get these slides, and I'd encourage you to go and watch this. It's just a short little video that explains Yalom's therapeutic factors, and in fact, one of the handouts you're going to be getting along with these slides includes the list of those factors. If you're not familiar, Yalom was a psychodynamic psychoanalyst, and he really wrote prolifically about those process groups, those higher end groups, and what are the specific factors that people are encouraged to move through to make it an effective process group. But I'm not going to go into that. You guys can check that out later. I just wanted to make it available to you. So what do we need to do to actually start to form a group? And this is true for kind of any type of group that we want to do. There are 5 major areas that are practical for starting a group. 1, we've already beat this to death, the rationale. What is the purpose of this group? What are you trying to accomplish? And 2, the objectives. What is specific and what is attainable? Right? So we don't want to set people up to fail. We don't want to set ourselves up to fail. And it's better to bite off a little bit less than a little too much. Practical considerations. Have you considered all of the things that could come into play with forming this group? The time of day it is, you know, who that's going to determine who might be able to attend. Is it before work? Is it after work? Is it in the middle of the day when only people who can't work can join? What are the procedures? So what are the specific techniques and the interventions that you're going to employ, and then what are the objectives and the rationale for each one of those techniques, because you need to be prepared to give that. And then what's the way that you're going to evaluate? How are you going to actually show that this has been helpful to people? The other thing to keep in mind, and this is a little bit harder, especially if you're running an IOP or if your just group is such a part of standard care, you might not be routinely screening for appropriateness for each group, and that can really be helpful. Even if it's just a brief check-in or chart review or something to have an idea, is this the right group for this person? And if it's a closed group, especially those middle group, evidence-based groups or a process group, is this the right mix of people? Because it's going to be a closed group, and I might want to have a particular mix of people that I know are going to work well together, complement each other, challenge each other in a healthy, effective way, and be thinking about that. And I can only know that if I'm screening. So asking questions like, should this person be included in this group at this time with this particular leader? What methods of screening am I going to use? Am I screening based on their diagnosis? I'm going to put everybody with an anxiety condition in this group. Am I screening based on substance of choice? Am I screening based on gender? So what is sort of the criteria that helps me to determine who belongs in this group now? And then who's going to benefit? That's really important. And who might not fit? Who are maybe the problems, the diagnoses, or the types of people that might not benefit from this group? They maybe need to benefit from a different group. And then just practical considerations, right? The composition, the size, is it open or is it closed? How long is it going to be? Hour, hour and a half, 30 minutes? Frequency of the meetings, once a week, twice a week, once a month? What's the frequency? And then where is it going to take place? So in terms of all groups, they move through some specific stages. The initial stage is where participants are sort of getting acquainted, they're testing the atmosphere, their risk-taking is relatively low, and they tend to be a little more tentative. They tend to be concerned with whether they're included or excluded, even if it's a psychoeducation group. Am I participating at the right level? And then the central issue that you're trying to think about as the facilitator, even in psychoed groups, is trust versus mistrust. How much trust and safety is in this group? Because that's going to determine how engaged the person becomes. And it's normal to have silence. It's normal to have awkwardness. That doesn't mean anything. That's just the initial stage. And then members are the silence, the awkwardness is they're trying to decide, is this safe or not? Common fears that people have, that anxiety about being accepted or rejected, concern about are they going to be judged by others, they don't want to be perceived as stupid or incompetent in any way, concerns about not fitting in, not knowing what's expected, so that's why that rationale is really, really important, and those objectives are really important. And then concern over communicating their feelings or their thoughts, that stuff's going to be judged. And just to highlight again, in the initial stage, it's also really important to keep the here and now focus. So that can energize the group, that can help people to understand it's okay to be exactly where I am right now. And if exactly where I am right now means I don't want to say a word, that's okay. So members know themselves, and we want to give them permission to disclose or not disclose and help to moderate that. So being in the here and now can really be a springboard for helping them to engage with more trust and more safety. How do we do it? Well, we have to be very good listeners. We have to have empathy. It's helpful to be really genuine with what you're feeling in the room. It feels like everybody's kind of having a rough day today. What do you guys think, right? Using humor, using respect, and you can confront, but very gently. So I've noticed so-and-so, you've been really quiet today. Is there anything that you'd like to share? It's okay if you don't, but I just wanted to offer that opportunity, right? So caring confrontation. The other thing is to keep about like group norms, because every group will go through certain norming processes. So there is an expectation, this is important to set up with your rules, promptness and regular attendance. What is the norm in terms of sharing? So is it normal? Is it not normal? Do we want it or do we not want it? The expectation of giving meaningful feedback. How do we talk to each other? How do we respect each other? How do we support and challenge each other? And then how do we keep each other in check with that here and now? And so knowing that these are really healthy group norms, keeping these things in mind can help us with setting up our rules for the group. So the members' expectations, this is where we want them to think about how they're going to express their reactions, that they can come prepared, giving them permission to basically be where they're at and have enough information to provide informed consent to do what they need to do to be an active participant. Our issues at the initial stage, well, we have a lot to manage, right? It's hard to achieve that balance, and so we're kind of juggling a lot of plates. It's important to have a lot of structure, so making sure that you're taking responsibility to prepare and to create that structure is going to enable more trust and safety. So how do you open the group, and then how do you close the group? In the transition stage, so sort of that next phase, what we're looking at are people feeling a little more defensive, right? So we see some of those defense structures start to get activated. And members, this is where they can start to test the leader, right? They can start to be a little rough around the edges and give us a hard time sometimes because they're struggling with wanting to play by the rules, but they're also having their own reactions and taking a little more risk because there is trust present. So when we see some of that, that's usually a good sign and not necessarily something that we want to just shut down immediately. And they're also testing the waters and learning to express themselves. So what are the things that we're looking for? We're looking for how hesitant they are in speaking up. We're looking for their willingness or unwillingness to actually do the work. Are they showing up prepared? Are they doing practice outside of session? Are we seeing them deny that there's anything wrong, that they even need to be there? That's a barometer of trust. Are we seeing them hide behind sort of big picture, real vague statements? Or are we seeing them make more specific, meaningful comments? And then how willing are they to deal with conflict? Fears at this stage, very similar to the initial stage. They don't want to make a fool of themselves. They don't want to lose control. They don't want to be too emotional. They don't want to self-disclose. They don't want to take up too much space in the room, and they definitely don't want to be judged. So some of the problematic behaviors that might show up, not participating at all, or the opposite, monopolizing the group, telling long stories that kind of suck up a lot of the group time, giving advice, well, you need to do this. We start to hear that sort of in that transition stage. Questioning particularly the group leader. Why are we doing this? I don't think you know what you're talking about. And then maybe even having a little bit of dependency show up, not being able to make a decision. And then at the higher end, intellectualizing. So making it all about in their head and not in their heart. So how do we deal with those difficult problems when they arise? We want to avoid sarcasm. We want to avoid public shaming. We just want to state our observations, right? So it sounds like, I wonder if what you're trying to say here is, we want to demonstrate sensitivity at all times, and we want to avoid taking it personally, which can be quite challenging, especially if it's directed toward us, but we can really model a super helpful, healthy way of responding to conflict when that comes up, and be genuine about it. And we want to encourage them to explore that too. So saying, you know, it's okay that it feels a little off. It's okay that this is uncomfortable because you're just sampling this. You're experimenting with a new way of being. And anytime we do something new, it's uncomfortable. So what do we do in this stage? We want to show that there is value in recognizing to deal with conflict, that that's helpful and that that's going to help them in the outside. We want to help them recognize their own behaviors that are showing up in the room, and then teach them to just respect that that's part of this process, that when that avoidance shows up, that's normal. We all feel that way, but you push through it. And then we model for them tactfully and encourage them to try to stay focused what's happening right now. Let's stay in this room. Then the next phase is the working stage. This is where they're gelling, there isn't all that conflict, there's good trust, and they're actually committed to doing the work or the goals of the group. There's not these dividing lines, things flow really easily. For those of you that have run a lot of groups, you know what this feels like when you hit this stage. You're like, everything is working great, we get along really well. If conflict shows up, we deal with it effectively, and people, it has a feeling to it that you know once you've hit the working stage. People tend to be supportive, they challenge each other in helpful ways, and they move through the therapeutic interventions really, really effectively. There's good group cohesion. You start to see the focus on the here and now is there. You don't have to do anything to make it happen, or very little to make it happen. The goals are clear. Everybody's in alignment with what the goals are. High cohesion. If conflict is there, it's explored, and explored non-defensively. And then members will make their needs known, and trust is very much increased. So what do we want to do? To get the group there, what we want to be mindful is there mistrust present. We want to look at how can we help them focus on themselves rather than each other? How can we look at getting them a little more involved or participating a little bit more? If conflict is there, are we ignoring it or avoiding it? Should we be dealing with it? And then is there any unclear communication? Are we not doing a good job setting up the structure or providing the rules? And then this is just a note on homework or practice assignments, keeping in mind that the group is not an end in itself, that most effective group work includes talking to them about, what did you learn today? How are you going to take it out of here? How are you going to practice between now and the next time I see you? And so even having like a little written prescription, like this is my goal for this next week, because the goal is for them to take what they've learned and transition it to their everyday life. Homework is really, really important to maximize what they've learned in group and what they're going to benefit from group. You don't have to dictate it. Members can come up with it on their own, or you can, as a group, you can collaborate with what the practice is. Nonetheless, it definitely should be, it should be a good piece of a meaningful working group. And then ideally, again, it's collaborative between you knowing the purpose of the group, and then the group itself. So I'm gonna stop there and open it up to any questions people might have. Are there any questions or comments or anything that we covered today that you want to discuss further, or things that you've done in your group work that I didn't cover that you could share with the group?
I think based on everything you shared in my experience with group, it really lined up well with what I've seen and the trainings I've had in the past. There was a part there at the beginning when you were kind of dividing it up between like your safety and stability and then your mourning and grief, and that you had that diagram, and I really liked that because that was new and I hadn't seen that before, and so that's something I'd be really interested in jumping further into in the future.
I can't see who's making that comment. Courtney?
Yeah.
Okay. Yeah, no, absolutely. And just that model, that stage model, it actually comes from Judith Herman's work. She wrote a book called Trauma and Recovery. And I think, the vast majority of our patients have experienced some kind of trauma in their life. And so utilizing a trauma-informed or trauma-based model that sort of ties things together can be a best practice and really helps establish that safety for people, and identify that not everybody comes to recovery ready to work, right? A lot of people come to recovery because of they're being mandated, or their family is coercing them in some way. They're in pre-contemplation. They don't want to make any changes, or their life is so chaotic and unstable. We don't want to be opening up any of that trauma or unpacking some of those emotions they're not ready to deal with yet. And so I think Judith Herman's model is really nice because it says the first thing we have to do is establish safety and stability. So we think about what are the groups that are going to help people do that. And then when they've transitioned through that and that's been achieved, build on the next stair step, which now let's focus on reducing all those symptoms, having you feel the stuff you've been trying not to feel for the past 10 years, and do it in a safe and constructive way. And then once that's accomplished, how do we get you reconnected to the broader world, to your family, to going back to work, to volunteering? What does that look like? And what are the skills, the group skills that you might need to accomplish that, right? So thinking about the types of groups that we have and where they fit in to that trauma recovery model, I have personally found to be very helpful.
Yeah, and I could see how in my own experience in observing different groups, you can definitely see the ones that have a lot of that structure promote a lot more of that safety in terms of sharing and how group members learn to interact with each other, versus the groups that don't have that, and even how the members in a way almost take over the group in comparison to the leader and kind of overshadow the leader and the goals because that structure isn't there.
Right, exactly. I totally agree with you. That we do a disservice when we don't provide the structure. Our goal, number one, is to maintain safety, and we can do that by having the group set up in such a way that safety can happen naturally. Totally agree. Thank you for that comment, Courtney. Anybody else? I know we're a few minutes over. Okay, well, I just want to thank everyone for joining us today and talking about this very important topic. I hope this was helpful and that this is information that you can take back to your practice and be thinking critically about how you run groups and how you might be able to make some changes if you need to make changes to how you run groups, because it is such an important part of substance use disorder treatment. So thank you so much for joining and for your commitment to being excellent clinicians and helping all of the people that you serve.
Thank you.
Thank you.